That's Renegade Science Podcast and your host Marie Nimpuer. And we continue our Chronicles of Paradise Island. And my guest today is an award-winning physician, immunotherapy scientist, immunologist, and cancer researcher focused on drug development. He is also an author of a book, The Immunity Solution, which has been published in English, Chinese, and Portuguese, reaching #1 bestseller status on Amazon in the UK, US, and Australia. Currently, he serves as a Chief Scientific Officer of First Bio Research, a California-based organization specializing in targeted research, scientific advisory services, and medical intelligence. Please welcome Dr. Leo Nissola. How are you doing?
I'm good. Enjoying my time in the island. How about you?
Yeah, also good. A bit, I would say, overwhelmed.
Yeah,
but happy, and especially happy to have you as my guest today.
Thank you for having me. Happy to be with you.
Let's start. How did you become a scientist? What is your personal story behind that?
That's a good story. It's a story that starts when I was a little boy.
As all stories.
Yeah. When I was a little kid, I told my mom that I wanted to be either a doctor, a scientist, or an astronaut. I have not gone into to the space yet, but it's on my horizon at some point. I'm not going to give up on that dream. But I eventually became a physician, then I became a scientist, and then I applied to go to the moon.
Oh,
and
really?
That is a different story. But yeah,
Tell us. As a scientist.
Yeah, so just mid-pandemic, I was working on COVID response in the US, waking up 3 a.m. To be on the news in New York at 7 a.m. I was living in San Francisco. The news actually happened in New York. So I had to wake up super early, and one day I was just exhausted. I was doing back-to-back interviews every day for several weeks, and the topics were very difficult to speak. And someone said, "Do you want to go to the moon?" There's a program Elon Musk is doing with a Japanese billionaire called Dear Moon Mission. And you just spend 21 days in space to see the dark side of the moon. And I'm like, sign me up.
And you're constantly listening to this album, Dark Side of the Moon, 21 days.
Yeah, so I was just like Pink Floyd, right? So yeah, I actually signed up, got my publicist to speak to the people, and I got up to 20. There were like thousands of people.
Wow.
Yeah, 20th place in the ranking, but there were like interviews and videos and tests and all sorts of things. It was a fun
five stages of job interview.
Yeah.
How to go to space.
Yeah, it was fun. I would definitely do it again. The mission got canceled.
I see. So you had all the chances, but it just didn't happen yet. Okay.
I'm confident one day the right opportunity will show up. I'm very passionate about space, which, by the way, the full moon is happening really soon.
Should we summon some demons?
I wouldn't say that, but definitely look at it and take some pictures.
Absolutely, and the full moon will be very beautiful in the jungle.
And so after I became a physician, I understood that I wanted to focus on a specific area. And I was questioning whether I wanted to stay in the same city for many years, or if I wanted to explore the world or move to a different country. And in that sense, it was very easy for me I'm passionate about languages, and it was very easy for me to decide that I didn't want to stay in the same place forever. So I started a research line on autoimmunity in Sao Paulo. And that research line became a huge data gathering enterprise. And it became too large to fit into a paper because we actually had a story to tell, but also people to educate upon it. So I started writing a book with a professor who was the lead rheumatologist for the country, basically. Anyway, so I went to Prague for Erasmus. I'm the only Brazilian to be ever accepted in Erasmus. And I spent some time in Prague, studied abroad, did my internship at the FIFA Excellence Center in sports medicine, and returned to finish my school. And then when I came back, my book was ready to be published. I was ready to get my diploma, and pharmaceutical companies were after me, trying to recruit me.
Everything, everywhere, all at once.
Exactly. It was a very interesting year. So I said yes to pharma immediately. I wanted to understand drug development. I wanted to understand medical affairs. I wanted to understand that side of the medical business, especially because I lost my grandma for Vioxx. She passed away when she took Vioxx. She was one of the many, many thousands of people around the world who were using that drug for 5 years, right? They were on the market for 5 years. And unfortunately, she passed away, but the drug was recalled by the FDA, and that's how it happened. So then I got to understand pharmaceutical businesses from a global perspective in global pharmaceutical companies. That's how I got to see what drug development was like. And later on in my career, I was invited to join the University of Texas, MD Anderson Cancer Center as a fellow at medical oncology, where we were seeing patients with advanced prostate cancer, and I was assisting the clinical team there on their clinical trials. So I was responsible for several clinical studies, and that was literally everything, everywhere, all at once. It was an intense period. I was working over 100 hours a week.
Oh, yeah, it looks like you're constantly doing that. At least that's my impression.
It does take a lot of effort to get from, a little boy in a little town in southern Brazil to suddenly go to the US and try to create change or a movement. And it does take a lot of dedication, for sure.
You are very much now interested in bioenhancement.
Yeah.
And bioenhancement is a very wide term. So how do you define that?
Bioenhancement is the use of biotech to improve life. That is the simplest way I can say it. How I got there, though, it's a different question. So when I was at MD Anderson, I was recruited by Sean Parker's enterprise to move to San Francisco and run early phase clinical studies. So I moved from Houston to San Francisco to conduct, author, develop early phase clinical studies for patients with advanced prostate cancer. They wanted someone who thinks outside the box, but is able to put it all inside the box in a different way. And I think clinical development requires a lot of critical thinking, but also creative thinking, because you can challenge the status quo when you know what you're doing, and you can propose novel ways of developing science that are not necessarily the same old bread and butter that has been done for a number of years. And to do a study that no one else was doing, I had to research what was out there, what is possible within the bounds of the regulatory approach that the FDA takes, but also how we could generate data that was relevant enough. And that's how I came about to designing Porter, which is the clinical study that was my first challenge there. And then I sort of became passionate by that little tiny fraction of the clinical development phase, which is the early stages. And I understood the importance of early stages. Because it's one thing doing a registrational trial where you already know what you're measuring, you just need more patients, and you just need more data, and you need to actually solidify a point. But when you're doing early signal detection, and when you're doing drug discovery at such early stages, it gets so much more interesting, because you have an idea and a few hypotheses, but not necessarily they would lead you to a grand idea for a registrational trial. Maybe you have to run more trials to find out more more different things. And one of the things that I learned while I was doing this was that there's potential for improvement. I was using very novel techniques, DNA-based plasmid vaccines. I was using compounds that we only had data from macaque. I was using electroporation devices that allow for the cell membrane to open up for a tiny fraction of time. And I was just like, wow, there's so much potential. At the same time, I've always have seen health as something extremely personable. And that's why I'm part of the American Personalized Medicine Coalition, where they try to petition for better policies around that. And I also realize how hard it is to get anything done through policy change. But that is a different topic. To land the answer on bioenhancement, I think I landed in bioenhancement because I became passionate about being a human. And I'm humanitarian at heart. And in that sense, being a clinical development, I understand the power of pharmaceuticals and also the power of individual autonomy and self-determination. And even though I'm not enhanced myself, I am empowered for individuals to make consented choices, to empower themselves, enhance their bodies, improve their life, developing high agency. And if you want to have a microchip implanted into your skin to improve an aspect of your life, and that is not going to cause you harm, I'm all up for it.
I would not agree that you are not enhanced because I know that you are following a specific diet, which is also daily habits are a part, maybe a conservative part of bioenhancement. So technically, most of us are enhanced. We're doing sport. We are following some routines to keep us healthy, being active, taking supplements. So all of that probably can be perceived as bioenhancement.
My definition is using biotech to improve life. It's as simple as it gets. But I do agree that enhancing ourselves is improving our air quality. It is improving our odds of fertility, whether that is through IVF or whether that is to doing some other interventions. And I think we have come to live longer because we improve our lives by science development, but also practical science, putting good science to good use.
I think the science would make no sense if we would be unable to apply it to our everyday lives in the end. What is interesting to me is when a person thinks about bioenhancement, she can imagine a full scope of potential options, from super race to created by some evil emperor to the immortal vampires, or to Superman. Do you think that in the current conditions with climate and quality of water and overpopulation and so on and so forth, we need bioenhancement to survive as a species?
I think in the overarching schema of what life is today and what the definition of life means for each person individually, I think we should try to enhance it. I think we should try to enhance every aspect of our lives. And that includes improving the air quality, which is super important, improving the food quality, which is also super important. I developed a research project on my own mid-pandemic because I realized that the quality of water in the United States was terrible. And I tested the water from my house, which was in a good neighborhood in San Francisco, and I found 57 cancer-causing chemicals coming out of the tap water. And they were like over 100 times the potential limit, but a cancer-causing chemical should not be.
I hope you don't drink it
No,
anymore.
no, definitely not.
Do you test all the other water before drinking it?
I don't test all the water, but I did test several brands of bottled water and water for purchase, and I ended up testing a bunch of different filters. So I found out there is one company in the United States that was able to provide the best filtering procedure for most of those chemicals. And after that, I retested again, and all the tests came better, negative for all of the chemicals that were positive before. So which was great. But again, it was an expensive endeavor. It was something that I could do myself because I am a clinical scientist and because I knew what I was doing because I'm a researcher. Now, what worries me is that not everyone has that opportunity.
Additionally, if we were able to make the water dirty and cancerogenic, we definitely need to enhance ourselves and to be able to research, to clean back the water and the air and so on.
Yeah.
Because I was unpleasantly surprised by the quality of food, because here in Honduras, you mostly get American food. Honestly saying, the quality of food is not spectacular. And I can understand why so many people who do not have access to organic supermarkets, who do not earn that much money, why they get obesity.
Yeah. The access to, packaged processed food is probably something that triggers people to just use them because they're easily accessible, they're cheaper, and they don't require preparing, they don't require cleaning up after, they don't require a bunch of different things. And that is a tough challenge, even in food deserts in the US, where people don't have access to grocery stores, and the closest grocery store that they can get is a convenience store. So those food deserts are a problem on their own, and they impact health because there's a part of the overarching understanding of what health is, which are called the social determinants of health. And the social determinants of health end up playing a larger part into your health or to someone else's health that they even care to think about.
Although there are people who, in the chase of living longer and healthier, so people are ready to experiment. And in the same time, they very often are quite suspicious towards the longevity treatments and solutions developed by scientists. As an example, here in Roatan, we have Mini Circle with their follistatin therapy. And I've heard from many people, I would never do that. This is changing something in my genes, in my DNA. Who knows what would happen? Why do you think people have such a controversial opinion towards longevity treatments?
Well, when you're building something that is decentralized, you sort of lose control of the narrative because there isn't an overarching agency trying to help promote or get your message across in a standardized fashion in which everyone would understand because it's coming from a single source. And I think that's one of the challenges of decentralization, losing control of the narrative. And if you want to nail a message, making sure everyone understands the same message, you provide standardized answers. So everyone
But then it's not interesting. As a journalist, I say that when you get standardized answers, this is so boring.
Yeah. But some things are very flexible. Some other things are facts. And facts do not care about your feelings.
Oh, no.
in that sense, I think, longevity is the science of celebrating life. Life is joyous. Life should be joyous. And if it's not, we should find out why it isn't. I think between the time of birth and the coffin, you have tremendous potential for pursuing your dreams, for chasing your life goals, for implementing changes into your life so you are able to experience those experiences that are on your bucket list. I think most of us have some sort of idea of what would make us happy. And if we don't, we should look into that. For some people, is improving their bodies, which is awesome. The body is the main reason why you're alive, right? Without it, you cannot be alive. And no one is going to step into that coffin for you. So taking yourself seriously allows for you to take more of a higher stand into having high agency. Now, another component of this is information. I usually say this because I read Mark Andreessen's, texts, blogs, posts, books, and listened to his podcast for a while. And I super agree with one thing that he says, which is most good books are freely available. Most important books the person should read are very easily available online for free. I love reading the classics, and I have a personal policy of only reading nonfiction. I think there's too much facts and data and important information for me to capture from real people, for me to step away from fiction. So in that sense, with AI, with good, important sources of literature, you have a solid base for information. You don't have to depend on tweets. You don't have to depend on media narratives. You can depend on the greats to understand what the world is and how to make the most out of life, right? And that includes health. When I was writing my book, The Immunity Solution, I actually went back to Galen. I went back to the people that have written about health in the past and how they were using their words to democratize science in the sense that the random person would understand it. And it's a little bit difficult, but I think there's a way of doing that. When you talk about self-medication, you talk about self. And self-medication for someone who is uneducated in sciences is complicated, but self-medication for people who are willing to consent to being part of an experimental therapy or consent to being part of the process of taking a supplement. And supplements and medications, they are different in some countries. Some countries, melatonin is forbidden and considered a drug. In some others, is considered a supplement. But melatonin has a tremendous impact on many parts of your body. Even so, it's regulatory capture or regulatory definitions depending on the land you're in. It doesn't change the compound, it changes the land. And it changes also the people that will be exposed to that. So I think education is important. I think education can be accessed today easily through AI. Just yesterday, there was a study that came out saying that ChatGPT 40 was able to score 95% of the test that doctors have to take for licensing in the US. That is a huge...
Will we get AI doctors
I
who are licensed?
I think we are going to get some form of AI assistant that will help doctors make the most informed decisions, and perhaps they will trigger an alarm if the doctor is making a mistake. In the years to come, I don't think we're very too far off from having Optimus Prime with a enhanced version of an AI LLM model that will be able to triage at least the first cases that are mild or eventually be replacing the GP soon.
So should the doctors be scared already to lose their jobs?
I think we shouldn't be scared about science developments at all. I think we should empower it. Life is here to be enhanced. We've enhanced life experience since the early days when we created fire. Fire is an enhancement on its own. So imagine if when someone was developing fire and someone put a dampen cloth onto it and said, no, fire is forbidden. Fire is what brought us what we are.
Well,
today.
there was a myth about Prometheus.
Yeah.
Who was punished for bringing fire to humans.
That's exactly my point.
Once I've read an interesting article about how prehistoric humans became Homo sapiens thanks to fire, because they were able to cook food and get more, make it more nutritious. There is a problem that you are unable to eat so much to feed the bigger brain. So thanks to fire, we were able to develop bigger brain and more complex brain.
I bet.
Yeah, without fire, we would not be sitting here today.
Yeah, absolutely. You know,
and go to space.
Or go to space.
Yeah,
that's
and
right.
to start the pandemic. So Western medicine is unlike medicine in China. It's not holistic. We treat the symptoms, and very often doctors treat specific problem and not looking holistically on all the body. And I loved your quote. Body functions more like a well-orchestrated symphony than isolated mechanism. So how would you apply this holistic approach to longevity?
Yeah, that's a great point, and I'm glad you read my article. I do believe truly that if we work in silos and we don't share what we're finding and we don't share our knowledge, and if we look at the body in silos, we're completely missing the point. Our body is functionable because it acts as a whole, right? It's very difficult and time-consuming and expensive to evaluate an individual as a whole, but it's the right thing to do. If you have an eye condition, or a heart condition, or a condition in your legs, you still have a condition, and you still have a condition that needs to be taken care of. Now, how do they relate? They relate because they are part of the same organism. So in that sense, I think one way that we can do that is looking at the body as oncologists do. Oncologists look at you in the first consultation, at least, entirely. You evaluate the skin, you evaluate the eye, you evaluate the mouth, the insides of your mouth.
So you are as well, because you are a cancer researcher, the most holistic doctors of the West.
I think oncologists are, definitely, because they take the individual as a whole.
Why?
Because it's important, because cancer operates in very mysterious ways. Still today, we understand a lot about cancer. We don't understand all there is to know about cancer. And one thing that cancers do are canker sores in your mouth, or they have weird tumor growth in the back of your throat or inside your tongue, and they can be hidden if you don't look for it. And the patient often will not complain about it for you, so you will not check it. But uveal melanoma, who happens to occur in your eye, is a very aggressive type of melanoma. So eyesight evaluation and the full eye completely evaluation is very important. It becomes a crucial part of that first initial understanding for a patient who has melanoma and other parts of the body, for example. So skin evaluation is also part of the generalist oncologist consultation. And why that is? Because your skin is the largest organ in your body, but also the largest organ with immune cells. And immune cells are your defense mechanisms. So immune cells live in your skin at a higher rate than in any other organ. So that's the importance of the immune system for your skin. And for cancer, immunology is paramount. They go out hand in hand. In one hand, you have cancer trying to invade, proliferate, grow, and eat up all of your resources. And the other side, you have your immune system defending, targeting, controlling, and alerting other body organisms to trigger symptoms so you act upon them. If a symptom is there, it's for you to act upon them and ask for assistance, ask for help, get tested, get some sort of help.
But let's go back to longevity. So we should look as a human as one interconnected system to understand how to prolong the lifespan and how to stay healthier, not only for first 50 years, but for 100 or 150 or 200 years.
Yeah, there are living creatures on this earth today that outlive humans, right?
Yeah, and who actually do not get old at all.
Yeah, exactly. So I think if we have the capacity to think about a problem, we have the capacity to solve the problem. And to solving problem requires critical thinking, but also creative thinking. And I think the beauty of human enhancement, and within it, this small little part, which is called longevity, there is a potential for a lot of creative thinking. And when I say creative thinking, I say thinking outside what has been thought before. How can we look at this from a 30,000 foot overview and say, here's what we have to play with. Right now, we're talking about the lifespan of a person in average of 80 years. How can we double that size? And how can we learn from all the other organisms that lived longer? And how can we implement genetic therapies, gene editing, gene silencing, and understand which transcription factors are actually turning on a gene and which transcription factors are turning off a gene? And when you implement that thinking with epigenetics and understanding where those epigenetic modifications came from, whether you got some shortened telomere length through cigarette smoking, or the consumption of heavy metals, or the consumption of cancer-causing chemicals via pesticides, you should be aware of which one of these cancer chemical sources are actually triggering these genes that will accelerate your aging process, would increase your odds of skin damage, or would increase your odds of white hair appearance and depleting all the melanin from your skin. So I think longevity problem solving, it's a little bit more interesting because it's creative, and we're talking about the celebration of life. So there's a joy that you bring to the table. We are not talking about death, dying, and disease. We're talking about how we can improve this beautiful thing called life.
Do we know any cases when animals have mechanisms to edit their DNA?
If animals have mechanisms?
Yes.
To humans?
Not humans, but humans, yes, but animals. Do we see that in animals, that their DNA is somehow edited in the process of life? If there are any mechanism to do that?
I've never seen a monkey doing self-experimentation on their own, but I've seen a lot of monkeys being experienced on.
Yeah, I mean, that would be interesting if something like that existed naturally.
Yeah, well, if you get the Greenland shark, the Greenland shark lives 500 years, right? It has a very long lifespan because it lives in the Arctic, and it lives under very low temperatures. With that low temperatures, you have low metabolism rates. So it's almost as if the Greenland shark is always meditating, right?
Constantly, not getting much stress.
And the first time that a Greenland shark actually reaches the sexual maturity for reproduction is when he's 150 years old.
Ooh. So
life is separated in phases. When we're talking about longevity, often we look at an old person, right? And I think we should perhaps look at the opposite. Instead of making the old young again, maybe we should consider
keep a person young.
Keep a person younger for longer. And keeping a person younger for longer is pretty much the best way of improving biological age or improving the DNA methylation rate, because DNA methylation is one of the most important biological markers for aging.
What can we do now to bring longevity to people?
I think that's a wonderful point, and probably one of the missions that I have over the next 5 to 10 years, which is to democratize longevity. And to democratize longevity, in my perspective, you require education. And education doesn't necessarily mean proper training by going to a school and learning from a priest that is just giving you the talking points that you should have or axioms that you should follow, but rather having a 2.0 version of education, which is gamified, which is a journey that is interesting to you, that you get some incentive in participating in that discussion or conversation. And I think access is important. Right now, we're talking about individuals who are very successful in their field being able to afford novel therapies. This is great. Perhaps we wouldn't be able to do that in the 80s. Right now, we are already talking about it at a global level. And I think the way to do it is to understand what should we scale from all those things that have been tried. What should we scale and which pace we should scale? And I think the first thing that we should scale right now is awareness.
Let more people know that they can affect their lifespan.
Yes.
Yeah, that they can improve their health by following simple daily habits. Yeah, eating healthier.
Yeah.
Getting training.
Yeah, if you wrote the immunity solution, I often talk about simple lifestyle changes. And I think it always starts with developing high agency. So you become aware of what you're doing and what part of what you're doing is you're making yourself going down the pathway of death quicker, or you're going down the pathway of living longer and healthier, right? And I think if people are aware of those two different fork roads, you're able to say which one of these visions would you like to have, to live 70 years and call that a life, or to be able to reach to 70 feeling like a 20-year-old or a 30-year-old, or having the stamina of someone on their prime time. And I think it's possible. It's possible. I've been able to decrease the DNA methylation rate of my body only through lifestyle changes, only through diet, exercise, meditation, and studying and critical thinking and critical choice making. I'm not opposed to enhancement at all. I am very supportive of enhancement. But there are many solutions. Like most problems in life, you have many solutions that you can take. Some solutions will require some additional treatment and additional tools. Some solutions will require a little bit more of life improvement from your perspective. What you're consuming, how often do you eat? Why do you eat in a way that it's not conducive to the longer lifespan? Question I ask people often is, how old would you say you are if you don't know your age? And another question that I ask when people come from advice is, how long would you like to live? And the third question that I ask is why? So if you understand your motivation and you understand the vision and you understand the current situation, you have enough data points to create a path and to create a journey that is, of course, holistic in the sense of the word, but it is about you and your relationship to life. I think most people want to live longer because they enjoy the life experience. And if you don't enjoy the life experience, that should be your starting point. Why am I not enjoying life? What part of life should I be looking into deeper to understand that it requires me to change it? Whether that is a relationship with your body, whether that is a relationship with your life at work, whether that is your social circle, whether that is a relationship with another partner. A part of it has got to change if you don't feel that life is worth living. And we do have, a tremendous focus on mental health as if it was this complete separate subject that some people experience challenges with that is completely detached from life itself. Mm-hmm. And I see it as a very intricate part. So to give it back to you, I do believe it's a very, very well orchestrated symphony when played well. And it can be a very tough music to listen to if you don't play it well, if you don't play your chords right.
I see how many discoveries happen and that people develop amazing things. The frontier tech, how to align that with a situation in public health. Yeah, in hospitals, very often doctors, they do not have neither training or access to technology, and they would love to. How to fix that?
Yeah, I think the number one challenge on between tech and patients is scientific literacy. We saw that throughout the pandemic. A lot of my work throughout the pandemic was talking about science, and science communication is challenging in a place where 130 million Americans are scientific illiterate. So literacy skills become extremely important in the age of AI. And I think, the ever-decreasing attention span that we are seeing on teenage populations and children in general, overall, the world truly is something that should trigger an alarm. We're not teaching children right now to increase longer lifespans or to have longer cognition attention spans. And I think when we talk about artificial intelligence, we're talking about intelligence that is capable of producing not only content, but creating answers to questions that would help people that are alive to solve their problems. But if you don't have cognitive stimulation, you probably fall under the tight grip of the lack of intelligence. And natural intelligence is the ability to make internal processes and rational thinking or critical thinking, and being able to answer a yes or no question, answer a simple equation, or being able to figure it out your own personal challenges. And I think in that sense, the biggest gap between tech and the public, it's actually education on very basic fundamental concepts.
So it's not like government which cannot keep the pace of rapidly evolving technology to transport the technology to general public. It's still illiteracy and a lack of knowledge in the first place.
I think we should rethink the whole thing. It's a beautiful thing to be in a crisis because in crises you see all the things that do not work, right? Someone gets into a situation where no one knows how to figure that out. Well, great. Maybe you need a process for that. And I think we are seeing so many concurrent crises around all public sectors around the world that takes us, maybe we should take a step back and understand, look as an outsider, what we are having as of, a population of the world today. We have people who are illiterate. We have a tremendous number of people with preventable diseases. We have a technology that is potentially going to disrupt the workforce in the coming years to a degree in which we are not capable today of solving. At the same time, we have biotechnology developments coming to market in the speed of light. And in between all of that, you have regulators who are very much unaware of how to implement those changes. And you have people who are aware and saying, maybe this should be available for more people. And I think, maybe someone should raise their hand. And I think the community around human enhancement is about raising your hand and saying, hey, there are a lot of problems. I'm going to solve one of them. And I think we should all play a role into this problem solving part, because depending on a big, paternalistic government to give you all that you want or all that you need, it's perhaps not the right solution. I would look into, asking seasoned CEOs, seasoned executives, people who have a proven track record of within the corporate world and within business and in life in general, to ask them, how do we solve these issues? I'm not a financial expert, so I'm not able to provide, advice on the economy. Do I know that the economy needs help? Absolutely. So that's my take on it.
I believe that every person would benefit if he started with himself or herself. So the change starts small, and everyone can spend a few hours educating himself on the topic of their own health. Read your book, The Immunity Solution, as an example.
Definitely.
Yeah, and find ways how to become healthier and live longer.
I agree.
Thank you so much for being my guest today. It was a very enlightening talk.
Thanks so much for having me. It's a pleasure to speak with you. I truly appreciate the change that you're trying to impact in the world. Very helpful. I think it's very helpful for a lot of people, especially for patients that are at home right now waiting for the treatments that you're going to empower through your company. By empowering entrepreneurs, you're actually going to empower patients and help them. It's not easy to implement change at a global scale, and just the fact that you have that understanding and capacity that it can be done, it opens up the possibility of it being done. So thank you for having me. It's been wonderful to be with you.
Thank you so much. Bye-bye.
Ciao.